Welcome to my Well Visit series, your go-to guide for every checkup from birth to 18 years, with insight from a healthcare provider and a first-time mom who's going through it. Hey everyone, my name is Jessica, and I'm a board-certified pediatric nurse practitioner in primary care and a brand new mom. I just gave birth to the cutest, squishiest little guy, and let me tell you, labor was something else. It was an out-of-body experience. I can't believe my body went through that, and it was a full-on marathon, but it was worth it. Sleep? Who is she? Forgot about her. And coffee. She's my new best friend. Let's dive into what you can expect on your baby's first checkup, the newborn well visit. Let's get to it. So the newborn well visit is usually scheduled around 3 to 5 days after birth. You're going to come into clinic. We're going to have a new patient process going on and ask you about birth history just to get to know you and your baby. So we're going to ask about labor and delivery. Was it C-section, vaginal delivery, or was it assisted? How are things going at home? And all the good stuff. And then we're going to ask about feeding, diapers, sleeping, and how you're doing, because both moms and dads matter in this journey, because it's a whole community that we need to do to be able to tackle and take care of a newborn, right? So what's normal with newborns? So for feeding, you can expect it to be every 2 to 3 hours, including overnight. Yes, 3 a.m. Yes, at 5 a.m. And yes, they can cluster feed and feed about every 30 minutes to an hour. So hello to eye bags and hello to sleep deprivation. Makeup does the job. And with that, it's really just important that you wake up the baby every 2 to 3 hours, because they lose about 7 to 10% of their birth weight in that first 2 weeks and then gain it back in that 2-week mark. So it's really important that we're keeping track of that and that you set the alarms to be able to not go longer than 3 hours. If you want me to discuss breastfeeding and formula feeding, I can make a separate video for this, so just leave a comment below if you'd like for me to do that. Next is your wet diapers. 6 to 8 wet diapers equals hydration goals. With that, typically in the very first few days of life, it is a lot less than 6 to 8, but that is the goal. And because, breastfeeding, especially when you're trying to build supply, it's a little less diapers than what you would expect with that 6 to 8 wet diapers. So stools or poopy diapers. So the very, very first poop that your baby will have will be the color black. It's what we call meconium. Completely normal. Essentially, it'll transition to whatever color you want. Just kidding. It's going to be green, mustardy color, yellow color. It could be seedy, it could be loose, all sorts of things. And with that, the biggest things to be concerned with stools is if it's white, pale gray, if there's any blood, if the black poops continue on after discharge, and if there's any mucus in those stools. So those signs you have to tell your provider if you're seeing any of that in the poop. Otherwise, it's A-okay. Next is sleep. They sleep a lot, about 14 to 17 hours in a 24-hour period. So you don't get to sleep, but they get to sleep. They're the boss now. Then we're going to head to the physical exam portion of the visit. So basically, first they're going to get the weight, length, head size of the baby, and they're going to put it in a growth chart, plot it in a growth chart just like so. And after that, they're going to get the vital signs and make sure heart rate, respirations, temperature, and oxygen saturations are all normal. Then the provider will talk to you about if there's any abnormalities in it, if there's changes in the feedings that you need to do to be able to get the weight up, or if there's any concerns with any of those measurements. Then we're going to go to the head to toe exam. Basically, the provider is going to go ahead and look at the skin, make sure it's not too yellow, pale, blue, or anything like that. Then we're going to listen to heart and lungs, listen to belly, feel on the belly, look at that umbilical cord stump, make sure that it's not looking infected. Then we're going to check your head, eyes, nose, mouth, ears, all the good stuff, making sure everything looks normal. Looking at the genital area as well. Also the hips, we're going to do this maneuver to make sure that there's no clicks in that. And then we're going to turn baby around on tummy time, make sure that they can try to at least lift their head a little bit. Look at the back, look at the skin at the back, any birthmarks or anything like that. Look at the buttocks area, making sure that there's no hair formation around that sacral region or any sort of sacral dimple, to make sure that they're transitioning out of the womb correctly. So that's really the main purpose of the physical exam, is that making sure that the baby is healthy healthy and that they're transitioning well out of the womb. During this exam, we're also going to be checking some newborn reflexes. So them going like this whenever you kind of drop them down a little bit, or they just startle with, the littlest things, that's completely normal. That is a great sign for neurodevelopment. If you want me to discuss other newborn reflexes or go through it with you, I can also make another video for that. So leave in the comment below if you're interested. Next is your milestones. Even now, babies got goals. Sucking and rooting reflex is an important survival skill for them to be able to feed and grow. Another thing that you could see is that brief head lift whenever they're doing tummy time. And yes, they can start tummy time as early as a newborn. Just make sure that it's supervised. You can do it on your chest or you can do it on a flat surface. With vision, they can see about 8 to 12 inches away when you're holding them like this. And then with hearing, they can hear or they can respond to sound, especially your voice. With hearing, just making sure that if they failed the newborn hearing screen at the hospital, that you mention that to your provider, just so that they can make the appropriate outpatient follow-up. Now we're going to talk about anticipatory guidance. This is the real-world tips and tricks that you need to know to be able to survive the newborn stage. First things first, safe sleep. Back to sleep, in their own crib, no loose anything. We usually recommend room sharing for the first 6 months. I'm going to have a whole video on this coming. Then your tummy time. 1 to 2 minutes a few times a day. Work your way up to about 15 to 20 minutes by the end of the month. Tummy time is really good because it strengthens the muscles in the neck, shoulders, arms, and core muscles for the baby, essentially improving their motor development and also preventing that flat head. Then you have your umbilical cord stump care. With umbilical cord, make sure you keep it dry, leave it alone. It's going to fall off in the next 1 to 3 weeks. And then after that, you can do water submersion. But in the meantime, while it's healing and while you're waiting for it to fall off, sponge baths only. If it's starting to look swollen, if there's any redness, if there's any smell or anything oozing out of it, then that's when you call us. Sunlight exposure. Keep baby out of direct sunlight. We usually don't recommend sunscreen until after 6 months old. Make sure that you're using hats, always have a shade, and have light clothing. Infection prevention or infection control. Limit visitors, especially if they are sick. Avoid kissing. Make sure you're washing your hands or putting sanitizer every time you touch baby. If there is any fevers above 100.4 Fahrenheit, then go to the ER immediately. Then you have your circumcision care. Keep it clean. Put petroleum jelly with every single diaper change. If there is any sort of bleeding or if baby's not peeing, that's when you call us. And then lastly is your car seat safety. Car seat safety, make sure that they're in the back, rear facing, you have a snug harness, and then the clip is at armpit level, and making sure that, if you don't know how to put it on or if you have questions with putting the car seat in the car, go to a car seat technician, usually the fire departments or the hospital where your baby is born can provide that. In this visit, we also make sure that mom is doing okay. We usually give a survey for postpartum depression so that we can discuss concerns if needed, because mom is important and mom needs to be taken care of to be able to take care of baby as well.
And lastly, we're going to talk about warning signs for your baby. So when to call your healthcare provider versus when you have to go to the emergency room immediately. So when to call your healthcare provider. Let's first talk about feeding. If they're having poor feeding, they refuse to eat or eat significantly less than usual, they're having difficulty latching on, is often going longer than 4 hours between their feedings, needs to be awakened often to feed and acts hungry frequently after breastfeeding, chokes routinely during feedings, and is not eating at least 8 times every 24 hours, then that's when you call us. Next is your bowel and bladder function. If they're having fewer than 6 wet diapers a day by day 5, if they're having reddish stain in more than 1 diaper after day 3, and those stools consistency and color that I talked about earlier, if it's white, pale gray, continuing to have blood or mucus, continuing to pass meconium after 3 days, then call us. If it's watery, like diarrhea, or pebbles, like constipation, call us as well. Changes in behavior. If they're suddenly or unusually sleepy or hard to wake up, they cry constantly or cries in a way that indicates distress, or if they're having any projectile vomiting. Their skin color, if they're starting to get jaundice or if their jaundice is getting worse in the eyes and in the skin. Next is when they have to go to the emergency room. So if they're having any rectal temperature of 100.4 Fahrenheit or higher, they have to go to the emergency room to rule out other causes. They are not vaccinated yet and they are completely immunocompromised, so making sure that we rule out all of the things that we need to in the emergency room department. Another thing would be green or bloody vomiting, if they're having difficulty breathing, if they're having blue lips, tongue, or mouth, if they're having tremors or seizures, if they're having a bulging soft spot when they're calm, or a sunken soft spot when there are signs of dehydration, like they're not feeding or they're not peeing. Another thing would be if they've had a major injury or fall, especially if followed by unusual behavior, is suddenly floppy, pale, or cold to the touch. With these signs, it's very, very important to go to the emergency room or call 911 immediately, whichever is faster or how your baby is looking.
Thanks so much for watching. Whether you're a new parent or even a pediatric nurse practitioner student learning the ropes, I'm so glad you're here. If it helped, please like, subscribe, and follow along with me. I'm going to go through every single well visit from birth to 18 years of age. And tell me in the comments, what questions do you have for the next visit, or what topic do you want me to cover next? See you next time.